In this video, I'm going to show you how to screen for proteinuria and ketonuria doing a urine analysis. First, I'm going to tell you how to obtain an appropriate urine sample from a patient and how to prepare yourself and the instruments needed to perform the test. Second, I'm going to show you how to measure urine ketones and urine protein using a urine dipstick or test strip and how to interpret the results. You'll need to have ready a watch, a urine sample pot, and a urine testing dipstick kit. So, to be ready to perform the test, you should first wash your hands and wear gloves. It is important to ensure that the urine sample tube is labeled correctly with the patient's and test's information, such as the name of the patient, date of birth, specimen which is urine, the date and time, and other relevant information. The urine test strips will come in a tube similar to this one. You need to check that the expiry date has not been reached. The strip looks like this. It has several urine pads with different colors, each one for a different test. Here in the colors reference chart, you can see in the left-hand side the name of each of the tests that you can do with this reagent strip. We are testing for protein, and for patients newly diagnosed as having diabetes, we will also test for ketones. So we are interested in this one here that says protein and in this one here that says ketones. When the patients are ready, discuss with them to please provide a urine sample. Ask them to please try to fill the pot with urine so that the reagent strip can be dipped fully into the pot. Once you have the sample ready, perform the test within 1 hour of urine sample collection. Take a reagent strip and put back again the lid so that no air gets into the tube, which could affect the remaining strips in it. Then, take the urine sample, unscrew the lid and introduce the reagent strip fully in so that all colors are immersed. Once you have done this, remove the test strip from the urine sample, hold the strip horizontally and not vertically, leave it on the side and start the timer. The results are ready to be read. For this, put the test strip next to the color chart and compare the color of the test strip with the different possible colors for the ketonuria test. You can see that the strip color matches the color of the first column. This first colored square means that this patient doesn't have excess ketones in the urine. Here you can see this horizontal line that is a minus symbol, meaning that the test result is negative for excess ketones in the urine. If the test color would have matched any of these other colors to the right-hand side of the negative test result, the test result would have been positive for excess ketones in the urine. The farther to the right-hand side the squares are, the higher would be the level of excess ketones in the urine. Below the color squares, the chart shows numbers indicating the amount of excess ketones in the urine. Now, for the proteinuria test, you have to follow the same procedure, but this time looking at the possible result colors of the protein test. Compare the test strip with the possible result colors here. You can see that the color on the strip matches the color on the first column, which has a negative symbol, which means that this patient doesn't have excess proteins in the urine. The same as for the ketonuria analysis. If the color would have matched any of these other colors to the right-hand side of the negative test result, the test result would have been positive for excess proteins in the urine. The more to the right-hand side the colored squares are, the higher would be the level of excess protein in the urine. Below the color squares, the chart shows numbers indicating the amount of excess protein in the urine.